Hello, everybody. This is actually greatest news, and I want to say thank you very much for all of you for supporting me and tuning in to this channel. Now, I know I've been actually out for quite some times without, posting and all that. I've actually stayed longer without posting. I think it could be 2-3 weeks. It's because I'm actually taking care of my sick parents, and at times it is very, very, very challenging. I'm taking care of my mom, and at times traveling or maybe going back and forth, and there's sometimes medical stuff that might be required. So that is why at times I may not actually be always here. But all that said and done, the church is still true. And the gospel of Jesus Christ will still continue to be, shared and continued also, like the Savior said, continue even until it crosses the entire continent or the entire world. Now, this is one of the greatest news here, that most of you know that there was an outbreak of Ebola virus disease, and majorly it has been in DRC Congo, and this is a very lethal disease, very, very lethal disease. It's a virus disease, and that's, they say, once somebody contracts Ebola, you have only 24 hours to live, because you start bleeding from every pore of your body, or your ears, your nose, your eyes, your mouth, you bleed. So it's a very, very serious and lethal disease. And I first started hearing about Ebola some years back when I was still in school. Years back, Ebola, and mostly it was actually in Congo. And this is a disease that has been always resurfacing every now and then, even though there are some people who will argue that it could be a biological weapon that is being tested there. But I don't know, man. I don't know anything about biological weapons and all that stuff. But this is a virus disease that has been killing mostly our brothers and sisters in Congo. And the Church of Jesus Christ of Latter-day Saints actually donated some of the medical aid to these people, that is to the people who are infected by the Ebola. Like you can see there, church provides aid in fight against Ebola virus in the DRC. So the church has actually partnered with the National Institute of Biomedical Research in the DRC to fight Ebola. So the church is also sharing its expertise. And this is one of the area, I think is an area 70 in Congo. Is it area 70 or area presidency in Congo? Yeah, it's an area 70. This was Elder Mwanke Baker. It's called Elder Mwanke Baker David Ngabizele. He's an area 70. He's the one that actually presents a sample of the donated equipment to Dr. Jean-Jacques Moyembe, Director General of the INRB in Kinshasa, DRC, in the presence of staff members. This was in July 16th on 2026. So the church has actually fully continued supporting different governments in ensuring that their citizens are safe. And just like the way it says here, Kinshasa, July 16, 2026, the Church of Jesus Christ of Latter-day Saints has provided significant support to the fight against Ebola virus disease in the Democratic Republic of Congo, in partnership with the National Institute for Biomedical Research. An official ceremony for the handover of supplies and equipments was held at the INRB headquarters in Kinshasa. This contribution is intended to strengthen the operational capacity of teams involved in Ebola surveillance, prevention, research, and patient care. On this occasion, the church donated a range of equipments and supplies to support ongoing public health response efforts. These resources will help improve early case detection, enhance the quality of care, and increase the speed and effectiveness of health teams' interventions in the field. So the ceremony included remarks from Dr. Jean-Jacques Muyembe, Director General of the Institute, accompanied by members of his team, and Elder Mwanke Beka David Ngabizele, that is the Area 70, representing the Church of Jesus Christ of Latter-day Saints, accompanied by members of the Africa Central Area Communications team, including Brother Didier Buloki and Brother Eli Twikala. Speaking on behalf of the church, Elder Ngabizele praised the efforts of the government of the Democratic Republic of the Congo, healthcare professionals, researchers, humanitarian partners, and all those engaged in the fight against the disease. You know, I always, man, anybody that is working in the hospital, man, I always salute you. You people are the best. You people are always the best. You know, at times you are in the forefront, you know, risking your lives to save those who are infected. You're actually our soldiers. And all those who are working in any health practitioner, you know, anyone that works in the hospital, you know, these institutes of research, laboratories and all that, these people need to be given you know, a round of applause. They are our heroes. These are people who actually save lives. I always respect anyone that works in the hospital, whether you are a cleaner, whether you are a cook. You people are the best. You are actually God. You have a calling. You know, you have a calling, and that calling is just unique. Very, very unique calling. You know, so these are the supplies, as you can see here. These are the supplies and many more that the church had actually contributed to help people who are combated with Ebola. Now, some people may think when we mention Ebola disease, they may think that this is just a joke. I'm telling you, Ebola is a very serious disease. And it's a virus. It's a viral disease, you know, that once you have it, there is no cure. There is no cure for it. You have only 24 hours to live, because the moment you are in it, you start bleeding from every place of your body. You know, it's a horror. And you can imagine what these people are always subjected to. You know, always seeing things that are not good for humanity, you know. You know, this is actually something so serious. And a friend of mine was kind of like sharing with me, because he's a Congolese, and he was saying that when you see somebody that has contracted Ebola, it is actually horror. It is something that affects even your psychology. You know, for people who have had patients with Ebola, they know what exactly really happens. And we actually thank the Church of Jesus Christ of Latter-day Saints for what they've done. You know, they've contributed these supplies to the, you know, to the government of DRC, to help them also combat this disease and take care of the patients more effectively. Man, round of applause to the Church of Jesus Christ of Latter-day Saints there. That is what the Lord actually directed. You know, that is what the Lord really directed. And we thank God for what the church has done there. Otherwise, thank you very much. God bless you. If anything, just let me know what you think about what the church really has done. And if you have any more ideas of what the church has done, please let me know, or write from the comment section there, so that we can fully discuss about these things. And for those who may feel that the church is not the right church, that one, I think I'm sorry for you. You need to pray more hard and read your scriptures, so that you can know for yourself what the Church of Jesus Christ of Latter-day Saints is all about. Otherwise, thank you very much. God bless you. Looking forward to see you again next time. Thank you.